So I've had a lot of clinicians ask me, does it matter when you use these scraping tools? Do you have to be really aggressive? Does it matter the direction? Do I need to go, with the muscle fibers, across the muscle fibers, proximal to distal or distal to proximal? Do I hold the blade at a certain angle and all these kind of things? So many strokes, certain tools to scan with and all that. Does that really matter? I don't have any evidence to support that it does matter. Maybe there are institutions and organizations out there that can supply that information. It says, yes, it matters. You must use it this way. I've learned this a bunch of different ways. I've certified with different companies. You pay these really expensive certification process, go to these courses and buy their very expensive tools. No, not this tool. I actually like this tool. This is a tool by Edge Mobility. And so I really like this tool. But you can really get bogged down in the exact science of what's going on or what's not going on. I'm not really aggressive when I do it. I think just a light scraping does really well. But you may get a patient in that says, I want this really aggressive. I want to feel like when I leave out of here, I'm bruised or red or whatever. And of course, you have to be careful. You have to know your anatomy and your landmarks. Not to do that over lymphatics in certain areas. All these different contraindications and all. But really, at the end of the day, I think that boils down to the patient's preference, your preference, and of course, whatever's beneficial to the patient without, hurting them or, causing some harm or, this kind of thing. So again, it doesn't really matter to me what type of tool you use. I have a ton of them at my clinic. We use all kinds, and it doesn't really matter the exact angle or the pressure, all that. I do it all different ways to make sure that I cover all the different options in most cases as far as what different companies have trained or what they teach. And I think if you do that, you're kind of going a little bit in all of it, or whatever's the best for the patient at the time, then you're going to be okay. So that is using scraping tools or instrument assisted soft tissue mobilization or instrument soft tissue mobilization. There's all these different terms for it. At the end of the day, you're using some sort of external tool other than your hands to do some soft tissue work. So I hope this video helps, guys. Thanks for watching.